Did you know that weight loss can potentially cause a prominent brow ridge? I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and in the last week I've seen a couple of interesting trends, and they're not the first two people that came to me, but literally 2 clinics in a row. I had 2 women back to back from out of state come to me, and they both told me the same scenario, and I'm starting to see this more and more. They're both quite thin, but in the last year to 2 years, they've had more thinning in their face, whether it be due to age or GLP-1s, but whatever prominent brow hooding they had before was accentuated. And part of this was they started to see a little bit of hollowing in their temples, and even started to feel like the skin started to thin on their forehead. Both of them started to see in photos kind of little humps right here, right over their eyebrows, and more accentuated hollowing in their eyes. And so they came to me for brow bone reduction. And I'm starting to see more and more women for that procedure to feminize their face. In photos, they're starting to notice that no fillers or even a brow lift or any of those procedures can help the problem that they're trying to solve. And so through the internet and internet search, they found me, and now we're going to do a brow bone reduction. The fat pads that cushion the orbital rim include one in the temples sitting just over the muscle called the temporalis muscle. There is an extension of the buccal fat pad that goes underneath the zygoma and up in the temples. That can shrink as you get older or with weight loss. The other fat pad that is present is right around the eye socket, the orbital fat. So that fat actually cushions the eyeball, keeps it, stable in its socket. That fat pad can shrink for a number of reasons. One can be age. That fat pad can get smaller or even protrude forward, which is what we address in upper and lower blepharoplasty. There are even some studies to show that Latisse, the medication that can cause the eyelashes to grow, can also cause some fat atrophy around the eyes. There's also subcutaneous fat just underneath the skin of the forehead, which can get thicker or thinner depending on what you're doing for your skin. If you're getting overly aggressive radiofrequency treatments, that can thin the subcutaneous fat a little bit. And then you have muscles both in and around that area too. So one of the muscles that gives volume around the upper face is the temporalis muscle. And that muscle sits right on the side of the forehead here. It can get really big if you have problems with clenching or, if you're constantly grinding your teeth. I sometimes do Botox injections into that muscle. Sometimes just over time, as you get older, that muscle can get a little smaller though. The other muscles in and around that area are the corrugator muscles here, the frontalis muscle in the forehead, and the procerus muscle here. So for someone who's getting repeated Botox injections over years, those muscles can atrophy and lead to a little bit of volume loss in that area. So both fat and muscle can shrink in that area, both from the non-surgical treatments we do, as well as age. Now, if someone already has a prominent brow ridge, it might be camouflaged early on. But if you're doing all these treatments or as you get older, it may be revealed to be the most obvious reason why there's shadowing and hooding over the eyes. And so at that point, really the only option is a brow bone reduction. So no other treatment can feminize the upper face or make the eyes look a little bit bigger other than that procedure. Now sometimes, especially in women, the frontal sinus, or the sinus between the eyes here, can be pretty small. If that's the case, all I have to do is do a little bit of contouring. The sides of the orbital rim here are really thick. The bone is really thick. So all I have to do is shave down the bone to allow the eye to look a little bit bigger. I even make the eye socket a little bit bigger in that procedure. And so it really brings emphasis to the upper face, where before you might have wanted to de-emphasize the upper face. It is a very, very powerful procedure in attractiveness and femininity, and a very safe procedure if done in the right hands. So what does it mean to get brow bone reduction? So I have to get access to the bone in some way. Usually I make an incision either right in the hairline or just behind the hairline, depending on where your natural hairline sits. That gives me access to the whole bone. I'm able to contour the bone, preserve the nerves that give sensation to the forehead with that access. If you have a prominent frontal sinus, so if it's very prominent in the middle, then I usually have to set the bone back and use some titanium plates and screws. And it's because if I were to just burr down the bone, you'd be left with a big hole in your head because you have the frontal sinus there. It's a pocket of air surrounded by bone. And so it's not safe to just burr the bone there. It would be left eggshell thin and probably not leave you with the best aesthetic outcome either. So I keep the bone nice and thick and set it back and use some very thin titanium plates and screws to keep the bone in the right position. I always lift the brows because if you think about if you have a very prominent brow ridge, it's stretching out the skin of the forehead. So if I were to do nothing with the eyebrows, you'd be left with brow hooding, which is not attractive either. And since the whole point of this procedure is to make the eyes look a little bit bigger, you're kind of defeating the original purpose of the procedure. So when I'm doing a brow lift after this procedure, I usually remove a little strip of skin just in front of the hairline. And that allows me to really elevate the eyebrows and actually lift and rotate the lateral brow, which looks really, really nice. Now, brow bone reduction is actually one of the easiest procedures I do to recover from, believe it or not. Here you have a row of stitches just at the hairline and some clips on the side. I leave a compressive wrap going around your forehead. Some people have some swelling and bruising around their eyes, but I give you some steroids afterwards to help with that. I also use something called tranexamic acid in the local anesthetic that I use, and that can help with bruising quite a bit. But eliminating things that can thin the blood before surgery can help as well. Things like alcohol, fish oil, any kind of supplements that's not absolutely necessary. I'll usually say just stop that before surgery, and that can help with bruising. I think this is going to become an even bigger trend, especially with things like Ozempic, with people that have a lot of facial volume loss that we're seeing lately. Anyone that naturally has bone structure that causes a prominent brow ridge is going to see that more and more as their facial volume reduces. Now, if you were to try to camouflage this without surgery, if you're not ready for surgery, you could do some filler in the temples. I would warn against any filler in the forehead above the orbital rim here if you wanted to try to camouflage. That's a pretty dangerous area. If you accidentally inject in a vein there or an artery, it can actually travel down that vein or artery and cause blindness. So I usually do not recommend any filler in the forehead for any reason. If you wanted to try something to smooth out that area, you could try something like Easy Gel, or you could do nano fat, which is like a liquid form with growth factors that has not been seen to cause vascular injury in that area. Either one of these options will not fix the actual root cause of the problem, which is prominence of the bone. What you need is more of a reductive procedure rather than an additive. So I hope this helps. Like I said, I'm seeing more and more women in my practice that have this issue, and there are not a lot of people in this country that are qualified to fix it. So if you have a prominent brow ridge and you're not sure what to do, don't hesitate to give our office a call. You can call 512-537-4191 or contact us through our website and we'll get back to you. I do this procedure multiple times a week. In my hands, it's very safe, and I know it feels scary, but we'll walk you through the whole process. Also, don't forget to like this video and subscribe to the channel as I deliver more helpful information for you. Take care.